Welcome, everybody, to Gulf Coast South AHEC's Career Chats program. This is for students, whether you be middle school or high school students, and you have some interest in health careers, but you're not quite sure what you want to be when you grow up. Well, the good news is you have plenty of options. There are over 300 health careers that you can choose from, not just being a doctor, a nurse, a dentist, a veterinarian. There's so many other health careers, and that's why we provide these career chat videos. So you can watch all these different videos from our website, get a glimpse into this career, see if it's something that you may be interested in. Please note on your screen that we have many different student programs available to you through GSAHEC, and they are all absolutely free, whether it be our health careers presentation video that you can find on our website, these career chat videos. We have health career camps during the summertime. We work with HOSA students throughout our 4-county service area. That's Charlotte, DeSoto, Manatee, and Sarasota counties within Florida. We also have a REACH intern program. I accept one high school student each semester. So that would be winter semester, spring semester, summer semester. So if you're interested in public health and in being one of our interns and earning some community service hours, we have that program. And then, of course, when you get into college, we have our Scholars Program, which is an intensive 2-year public health program. You can find more details about all of our REACH student programs. Again, they're free. You can find that information out on our website. You can see that information at the bottom of your screen, www.gsahec.org. I am very pleased today to bring to you our special guest. This is Deborah Jordan. I'm going to introduce you to her, and then we're going to get into the nitty-gritty of her career. Welcome, Deborah Jordan. Deborah has a master's degree in mental health counseling and is currently working as a client access manager at Centerstone. Deborah, first, let's discuss some of these credentials that I have behind your name. Let's start with LMHC. What the heck does that mean, Deborah?
LMHC stands for Licensed Mental Health Counselor. Across the different states, there could be an LPC, Licensed Professional Counselor, or LCSW, Licensed Clinical Social Worker. My degree path was Licensed Mental Health Counseling.
All right, fantastic. And I assume from looking at your credentials that you also have a specialty field. I see it as IMH-E. What's your specialty?
That stands for Infant Mental Health Endorsed. I'm endorsed in Tennessee and in Florida in infant mental health. That means that I took extra training in the development of the brain from infancy and up, and even some in utero. And so I'm able to assess the needs of a client based on their developmental stage.
Wonderful. So it's important that students understand, just like with almost every health career, there's a base career, but you can also continue on and receive specialty certifications. So I see here that you work at Centerstone here in Southwest Florida. What is Centerstone?
Centerstone is a behavioral health organization that covers mental health and substance abuse. They have inpatient and outpatient services. There's a wide variety of services offered to the community. In fact, there's very little that we don't do or need that we don't meet for our community. If you think about it, infancy through all ages, and we also cover crisis and things of that nature and work with law enforcement on training.
Mental health is a huge topic. And of course, it's been around since humans have been around, but it seems like it's become so very popular, most recently due to the pandemic. And we're going to get into some of those roles and how that has shaped your career right now. And I see at Centerstone that you work as a client access manager. What do you oversee at Centerstone?
I oversee our walk-in center, our access center, and mobile crisis for Manatee and DeSoto counties.
Okay, can you explain a little bit the differences between all those areas?
Mm-hmm. The walk-in center, I refer to sometimes as like a mailroom where everything gets sorted. Clients walk in, they're assessed, and it's decided what program they best fit in. The referrals are written, a full biopsychosocial is completed, and they're also triaged to see if they need inpatient care. Um, Crisis counseling is provided in that department, and basically all de-escalation skills, things of that nature. Those case managers in that department do a great job of assessing the needs of someone and putting them in the right department.
That's fantastic. So is it fair to say that you are definitely on the front lines when they come into Centerstone and trying to determine which is the best place to get them the help that they need?
Right, right. Do they need medication? Do they need therapy? Do they need both? Do they need help with homeless outreach? Things of that nature. Just about any area of need Centerstone tries to meet.
So when you go in to work every day, what is the atmosphere like at Centerstone?
It would depend on what department I'm in. All departments, I can say, are very dynamic, very busy, constantly changing. You can't, it's almost impossible to predict what a day would be like. We joke that when there's full moons, we're a little bit more busy, but really it could be any given day. For the walk-in center, a day is going to be typically fast-paced, seeing client after client after client, de-escalation. A lot of times clients will come in and they want medications immediately, and helping them to understand, it would be unethical or even dangerous to just write scripts without having full assessments and things of that nature. Most of the time people understand once they get that training or that education and knowing why. But other than that, in the Access Center, I didn't speak on that one, but the Access Center, I refer to more like a triage room for inpatient care. You get clients that do come in that need outpatient, and then they're put over in the walk-in center, but the Access Center is a more acute situation or scene, and people that come in there can often be detoxing or suicidal or homicidal or actively psychotic. They receive it's a central receiving facility at the Access Center. So law enforcement brings in Baker Acts or Marchman Acts, people under those that need immediate treatment. So they're triaged in that department as well. It's just highly acute, whereas in the outpatient, it's less acute. And sometimes clients are in the wrong department and they need to be guided to the department that'll meet their needs.
Now, you just mentioned a couple of pieces of terminology that I'd like to get some more detail on. Baker Act, Marchman Act. What are those that you're speaking of?
Okay, a Baker Act is a legal document that's signed has to be by a medical doctor or a psychiatrist or a licensed professional. And that is basically a statement saying that a client is dangerous to themselves or to other people, immediate danger, imminent danger. And it holds them for up to 72 hours to assess them for that danger or treat them and stabilize them. A Marchman Act is very similar, but it says that their substance use is immediate danger to themselves. And a Marchman Act has to be attained by family petitioning the court or law enforcement. And it would also help determine the treatment when they come in. Sometimes people are what we call comorbid. They have both substance abuse and mental health issues. And it's that Access Center that triages and finds out, okay, what's the most immediate need for this client? Where do they need to be and go?
Thank you for explaining that to our viewers. I love doing these career videos because I always learn something new every time. So thank you. That is wonderful. Now, you had mentioned also that sometimes medications might need to be prescribed. Is that something that a licensed mental health counselor can do, or are you working with physicians at Centerstone?
The licensed mental health counselors can't prescribe medications, but we do work with the psychiatrist to get them where they need to be. It's great at Centerstone specifically because you can get your therapeutic needs and your medication needs in the same location. And that allows for continuity of care. You see a therapist every week. You see a psychiatrist once every 3 months or once every 6 months, depending on the type of medication that you're taking. So say you come in and you're really lethargic and you're having trouble staying awake and you had a new medication, a month ago. Now this allows for your therapist to email or talk or work with your psychiatrist in the moment and or very quickly and help collaborate and come up with another appointment or something that you might need. So it is good to have those services done in the same house.
Absolutely, I agree, because when you need help right then. You don't need to make an appointment, and maybe they can fit you in 3 months from now. It's wonderful. It's kind of like a one-stop shopping there at Centerstone. That's fantastic. Now, what kind of patients do you work with there? We're talking age ranges. Do you have specifics?
No, because I'm infant mental, not every therapist is infant mental health endorsed, but um, when I do see patients, I'm management now, so I don't see them as often, I can work with any age range. Most therapists know and understand. Well, let me just say first that Centerstone works with all ages.
Okay.
Mobile crisis starts at age 5 through all adulthood. Um, Most therapists start to learn where they're really good at, where they feel comfortable with, where they feel most effective, and then they can pick and choose a little bit about what age group, but for the most part, Centerstone serves all ages.
Okay. When you mentioned that you worked with psychiatrists there, this is a theme that we see again and again in these career videos, is that no career is an island. They work with so many different staff members out there. And it's important for students to know this, because if they're interested in the field of mental health, they could choose to go to school to become a psychiatrist. They could choose to go to school and become a licensed mental health counselor. What other fellow staff members, what other careers do you work with there?
Oh goodness. So they're behavioral health techs, which are very important. They're highly sought after. Their education requirement is a high school diploma. Um, we depend on them greatly. Lots of training and through our organization on behavioral health and substance abuse and expectations and things of that nature, motivational interviewing, things that allow them to have the patience and lack of personalization to work with our clients. Then we also work with case management. It requires a bachelor's level in the mental health field. They're the ones that do the assessments that help make the determination of what needs to be done. They also do really well with treatment planning, the initial treatment planning. Inpatient, the case managers are good at going back and forth between the psychiatrist and the patient and helping utilize that gap, bridge that gap, and utilize the resources in that area. They're also really good at connecting to resources in the community. Um, we have homeless outreach, but there are other organizations in our community. Like you said, we don't live on an island. Organizations that work with people who've lost a parent, or equine therapy, things of that nature. And so a good bachelor's level case manager learns these resources and helps make that connections and those referrals. Um, then there are our interns. They're student interns who are in the process of getting a master's degree. And we welcome our student interns. It's a great way to get your feet wet, to come in and go, oh, this is what mental health is like. And then after they graduate, we have registered interns with the state. And those registered interns have the master's degree, but they're not yet licensed. It takes 1,500 hours and 2 years after your master's to get a licensure. So that gap is called registered interns in the state of Florida, and we work with them. Uh, they're great as therapists, and we also work with doc students that are going to get their psychology degree, and they'll specialize in testing, psychological testing, or other areas of that nature. And then we have our psychiatrist, and we have our full psychologist. So we have several different types of degrees in-house. We have our licensed clinical social workers, which are the counterparts of the LMHCs. It's basically a different licensure with the same career path, the same, almost the same training and things of that nature.
Wow, I had no idea. I mean, I knew that there was a lot of health careers that work within mental health counseling, but I had no idea there were that many. So thank you for explaining all of the different opportunities and career paths. And, it could start with a high school diploma and bachelor's degree, master's degree, all the way up to a doctorate degree. It's wonderful that students know the options they have. Now, of course, you have moved your way up through the ranks to become a client services manager. What's a typical day like for you, or is there any such thing as a typical day?
I don't think I could be complete in a job that had typical days because I've adapted to this. So there is no typical day because I cover mobile crisis. My day can start as soon as school starts because a lot of our calls for mobile crisis come from the school. Mobile crisis is 24 hours a day, 7 days a week. And those calls, whenever someone needs to be Baker acted or have an immediate hospitalization because they are at risk of death, whenever that happens, then I would be the one that would answer that. I'd send a case manager out to do the assessment, and then we would collaborate and see what needs to be done from there. We've added telehealth since COVID, and that has helped a little bit because it keeps me from having to be in multiple places at one time, or it allows me to be in multiple places at one time, I guess I should say. So the day can start as early as 8. The walk-in center is open from 10 to 7, and the access center is open 24/7. So there's a lot of, in my particular position, there's a lot of flexibility where if I need to go to a doctor appointment in the middle of the day, that's fine. But then there's also the real possibility that I'm having a late night call or going in. So there is no set hours so to speak, but the flexibility works well in my lifestyle. And a day could involve anything from de-escalating a very upset client or providing education to someone who doesn't understand what their child is experiencing, or signing off on treatment plans, providing diagnoses for those intakes that come in, or even helping clean up a mess that comes about when we're dealing with humans. So it could be all over the place. It could be anywhere.
I understand. And because of course you can't be on 24/7 all the time. That would be exhausting. You rely on fellow staff members and fellow client managers to help out with that. Because you have entry level positions and then you can work your way up into management. What type of salary ranges are we looking at?
I cannot speak for all of them, depending on degree, but I can say a licensed mental health counselor could potentially, once you're licensed, start looking at in a community mental health setting around 52,000 annually. And then if you're going into private practice, that can vary. I know some practitioners charge 133 an hour, and then they set their own hours. So then it's very hard to say what you're going to make annually because they set their own hours of, I'm just going to work 30 hours a week, or I'm just going to work 20. So it does vary greatly depending on if you're licensed, if you're registered intern. Registered interns probably make around 18 to 20 an hour. Then when you go to license, it's more 25. And then private practice, you would set your own rate.
All right. Thank you. It's important for students to know that, because you don't just graduate from college and say, all right, I'm ready to make the big bucks. Everybody's got to pay their dues. They've got to start out as the entry level and work their ways. But as with all health careers, because there's such a great need for them, the money comes. The money is always going to be good in health careers, and they're always going to need you in health career fields as well. Why did you decide to pursue this career path?
I get asked that a lot. I was the kind of person that people came to talk accidentally. You're in the gas station and someone just feels comfortable and they start talking. And that carried on to friends and family. And one day it dawned on me, if I'm going to be sharing these moments with people, if I'm going to be knowing about their intimate stuff, I probably should know what I'm doing. And so I decided to get the education to help me be better at guiding.
So about what point in your life was it that you figured this out? Was it before college, during college, after college? What did your career path look like? Was it a straight line, or did you meander a little bit?
I actually went back to college late in life. After school, I married, had children. I knew I was going to pursue a career eventually. When my children, it looked like they didn't need me as much, then I dove in. And because I knew my psychology was my interest, there was no deviation. I went straight through with psychology. The only I did want to go a little further into behavioral neuroscience, and I may still do that one day. But right now, I'm pretty comfortable where I'm at.
I tell you, no matter how many of these career videos that I do, I believe every single one I interview has a similar story. I thought I knew what I wanted to do, but then I changed to this. Or, life happens and I took care of my kids and then I went to school. So it's fantastic that students know it. Sometimes you may think you've got it figured out, but you learn as you go through life. And sometimes you may change careers.
Had I gone right after high school to college, I would have likely deviated several times.
Now, I know that I was in my mid 30s before I figured out what the heck it was that I wanted to do. It took several different starts and stops to figure out what I was good at and what I enjoyed, which is of course important because you're going to be doing your job for at least 40 years. You better like what you're doing each and every day. So what's the number one reason that keeps you going back to this job?
There are days, and it's not every day, but there are days that you go in and the main thing that people really need above all else, they really need just to be heard, you know, and that means you're not giving advice, you're just being with them and hearing them. Not, not just the nod your head, yes, 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 but actually hearing what they're saying and hearing what they're not saying. And if you're truly listening, you're hearing all of that. And there are days that I can hear someone and I can say it back to them, and you can see in their face that they've not been heard like that before. And those are the moments, and they're emotional moments, and they're the rewarding moments where you step back and go, just by being present, this person is better off. So
Yeah.
those keep me going. Those keep me excited about my path that I chose.
So helping somebody, we hear this again and again when we ask students, why do you want to go into health careers? Because I want to help people. So it's obvious that that's indeed what you're doing in
Mhm.
your career, and that's very satisfying. But of course, we have to talk about the flip side. What would be the least satisfying?
Um, the least satisfying, and I think it leads to burnout, people in my career, is when you see relapse on substance abuse. It is trying because you've worked with someone, particularly someone who may have CPS involvement and things of that nature, Child Protective Services, and there's a lot weighing in on their sobriety, and you get invested in their recovery and their sobriety, and you want this for them so bad. You want to see them succeed, and you may want it more than they do, or the addiction may just be so strong, and it is a disease, and it's not always a choice. So that can be very hard when you want something for a client and it's not achievable.
What do you feel is a common misconception about working in the mental health field?
A huge misconception, and I see this with interns and with clients, but a huge misconception is that a therapist is going to give you advice. A therapist should never give you advice, ever. You are the expert on you. You know more about yourself than anyone else on this planet. A therapist is going to guide you to discover your own truth. They're not going to give you advice. They shouldn't give you advice. They shouldn't self-disclose. They should be there with you while you take this journey. And the truth is, people will take their own advice before they will someone else's. So a therapist should not be given advice.
So it's not like we see on the cartoons where you have the couch and the client is laying down and the therapist is scribbling notes and there's no aha moment. This is what's wrong with you. This is what you need to turn your life around. It's a journey that you're taking with your clients.
Yeah, you're helping them to identify patterns. You're helping them to a lot of times we pay attention to one or the other, either how we're thinking or how we're feeling, and we're not connecting them. And so a good therapist is going to help you make that connection. You know, when this happens, you think this and you feel this way. Wow, how many times are you going to let this happen in your life because it's impacting you this way? It's a journey, and it is almost like a dance. And you're dancing with the client, or you're taking the journey with the client of self-discovery. You're not giving advice. You're not telling them what they should do or what they need, because the truth is each client knows themselves more than anyone. And there's things in that session, no matter how much they like their therapist, there's things they're not going to say. And their truth depends on those things as well.
Understood. Thank you for explaining that. And I know that some of the students that are watching this are going to think, this sounds interesting to me. I think I'm going to do some more research, see if this may be the field for me. So what we need to talk about now is, how do they get from middle school, high school to where you are now? What type of classes did you take in high school that you think helps you in your career?
Most people come into this field with an interest in psychology because we all want to know how the brain works, or most people do. Why did you do this? Everybody's looking for the whys, by the way, which is a terrible, terrible thing to look for. I always tell clients why is a bad word, because there's no satisfactory answer ever. It just leads to another why. And so, but psychology is usually the path that draws people in. I would recommend psychology and sociology classes to help kind of guide you, let you know if you're interested in it. As you get over into that's middle or that's high school. When you get into college, I would recommend not starting off, you get your general education classes for your associates. I would recommend not starting off saying, I'm going to do all psychology, because that's where people start off thinking they're going to be a psychologist, and that's a long journey. So I would do some psychology and other interest as well, and see if something piques you a little bit more, because you're not going to enjoy the field unless it's truly calling you. And I recommend at the high school level volunteering to do some internship or some shadowing, things of that nature, just checking it out and seeing how you feel. You may be very uncomfortable in intense situations, and you can't really do mental health if you're uncomfortable and intense. And maybe if you're uncomfortable, you need that exposure to get comfortable. But I do recommend you do some shadowing, some interning, just calling an office saying, hey, can I observe? Can I sit in? A lot of times you will get no, because the therapy session is a very private thing. But you'd be surprised too. Sometimes you'll have someone go, sure, I don't mind if they observe.
Yeah, and that's also excellent advice, because students, if they get told no again, they may get discouraged. And sure, there's HIPAA rules, and everything is private. But what they could also ask the therapist is, I understand that I may not be able to sit in on a session with your clients, but could I just pose some questions to you as the therapist, and you can give me an idea of what would happen if you saw a patient who had substance abuse? What would happen if you saw a patient who experienced some trauma in their childhood? And they could run scenarios with the therapist and still get a good idea if that's something that they would be interested in. And sampling, like you mentioned, sampling in college. Take some psychology classes, take some sociology classes, take all different classes, because then it'll help you determine your path, but it'll also make you a more well-rounded student. And I hear from college admissions again and again, they're looking for students who aren't just singularly focused in one area. They want them to know a myriad of topics out there. Now you have a master's degree. Where did you go to college for your bachelor's and then for your master's?
I started out at Columbia State and then moved over to Middle Tennessee State University. I got my bachelor's there with psychology. It was a pre-graduate degree because I knew I was going on to graduate school. And then I pursued my master's in clinical mental health there, also at the MTSU. Had they had a doctorate program at the time, I would have kept going, but they didn't have one.
Well, that brings me to my next question. Do you feel like you might still want to go back for a doctorate degree?
So there's a part of me and a part that should be in anyone in this field, because the field is always growing and changing, Mental health is a science that is fairly new when you look at the grand scheme of things, you know. So it's always changing, always growing, and always updating. So anyone going into this field needs to be open to the fact that they're never going to learn it all. There's always more to learn. And I call myself a forever student. After graduate school, after grad school, I became certified in TFCBT, trauma focused cognitive behavioral therapy, EMDR, which stands for eye movement desensitization and reprocessing. There's so many different types of therapy to continue learning, specializations that you can continue to get, or going back to school and getting other trainings and moving forward. I always recommend that. And I don't think you would be very successful in any medical or mental health field if you stopped and didn't continue to learn, because technology, what we know about brain scans, things of that nature, that's always growing. And really, we got to grow with the field.
I like that phrase, forever student, because it is true no matter what career that you want to go into, because we are never ever going to say, oh, I believe that's the last thing I ever need to learn. And done. My brain is full. Our brains are never full. There's always something more. I like how you phrased that. Now, one of the biggest questions that students always ask is, well, I don't have a money tree in the backyard, or my parents may not have enough money to help me get to college. How did you pay for your education?
My first two degrees, I paid cash for the first one. The second one, I did a student loan. And then after that, my husband was in the military. And so I used his GI Bill to pay for that one. Of course, we have lots and lots of student loan funding resources that you can get. And then there's the repayment program. Anyone going into this field, as long as they're not in private practice, any kind of community setting or working with substance abuse, has the opportunity to do the federal student loan repayment program. So after 120 payments, the loan is forgiven. And then, of course, while you're in school, you're not making payments, it's always deferred. And then 6 months after graduation, it's deferred, and then it picks up after that.
Well, wait a minute. You can go to school and then get your loan payment forgiven. That's fantastic. That's like winning the lottery. It's important that students understand that, I'm glad you brought up student loan, that 4-letter word loan, that it doesn't have to be scary to get a loan, because you're going to be making good money and it will either get paid back by you or loan repayment.
Mm-hmm.
A lot of students don't understand what's available. Yeah.
Yeah, you just have to be responsible. Don't borrow more than you need. I've seen that where people will borrow more than they really need. And they're like, well, I need a new laptop every semester, things of that nature. And they really don't. And then later they're like, whoa, that was, maybe shouldn't have done that. And taking a lot of classes that they don't need for fun. It's good to get, a variety, it is, but then also understand that you're paying for this variety. So if you don't need that third and fourth photography class or things like that, or then if it's not, just know that you're paying for it in the end. And then if you do stay in one of these fields that are not for profit, or they're for community mental health settings and things of that nature, there are government programs. They do that for education as well, that help repay those loans.
Absolutely. Our final question to you: what is your best piece of advice for students interested in this career field?
My best piece of advice is to learn not to personalize. Someone's success and someone's failure, or someone's lack of success yet, is completely dependent on that person, their past, their future, their perceptions, their strengths and their weaknesses and challenges. And all you can do is really be with them and help guide them. You can't take it personal when they fail, because that will burn you out very quickly. But on the flip side, you want to make sure you give them all the credit when they succeed, because that empowers them to succeed more.
Thank you. Thank you. I mean, excellent advice. This has been an eye-opening career chat. Deborah Jordan, everyone, thank you so much, Deborah, for taking time out of your busy schedule to come in here and explain about your career and tell us about the opportunities that are available to students out there. We sure do appreciate your time.
Thank you. Thanks for having me.